Okay. All right, so one of the questions is, what about the multivitamins you're recommending? We take 3 multivitamins. What's the plan for that? Is that forever? Do we ever adjust those? And if we're taking more multivitamins, should we take more creatine and whey protein than what you say in the manual? So first of all, what about the 3 multivitamins? That is a guess based on what we think is probably necessary for the first year. At the end of your first year, remember, and at every year afterwards, you're supposed to get blood tests. Okay? Now what we find is some people at the end of the first year taking 3 vitamins a day have too much of something, in which case you need to cut back. So for example, B6 or pyridoxine is a vitamin that sometimes can be too high in some of our patients who are taking 3 vitamins a day. So if your 1-year labs show anything that's too high, vitamin A rarely can be too high. If any of those are too high, then cut back. The guidance of 3 vitamins a day is based on that guess for the first year, and it's a pretty good guess. But if everything's okay at the end of the first year, then just leave that alone. Now, as far as the whey protein, glutamine, and creatine, there's actually almost no upper limit of how much you can take. We recommend something that we think is manageable, a couple of teaspoons or a couple of capsules per day. But you could, if you wanted to, take 3, 4, 5, 6, 7, 8, even 10 times that much. Now, we want to be careful. We don't want to interfere with your life. We want you to enjoy life and things like that. But those supplements, which are kind of food supplements, they're amino acids and protein, they're not bad, and you could take more if you wanted to. So there's no upper limit for that. And again, we think it's really valuable to take them. We don't think it's urgent for those of you who just had surgery last week. You don't need to run out, like an emergency, quick, run out of here right now and go get some creatine and take it. But we think over the long term, you're really going to be helped with vitality, with strength, with the feelings of well-being if you take some of those extra supplements, because otherwise your body is going to burn a moderate to high amount of muscle instead of burning fat. Okay.